As a recovery room nurse, I hear a lot of stories. First, when people come in, they tell a story about their expectation. And then when we call them back after their surgery, we hear their stories and what their experience was like. My name is Cis Ahearn, and I've been a nurse for 50 years. And I want to share with you some important things about your recovery and how to make it the least difficult experience you have. Our goal as recovery room nurses is that we get you home to your own comfortable bed as quickly as possible while you still have a little bit of the anesthesia on board, you're comfortable, and you're not nauseous. That is our goal, because all of us know that our beds are our comfort zone sometimes. And so I'm going to give you some advice on a couple of things that can help. You may ask, what are the three most important things to know before I come in for my surgery? These are things that sometimes get overlooked because they seem like simple things. So I'm going to share them with you. Be informed. Know about your surgery. Google your surgery. Sometimes we have to Google it because we want to know about how we're going to do this new procedure. Know what you know. And then if you have questions while you're looking at that, write them down and bring them with you for your pre-op visit with your doctor. Number two is plan ahead. Pick up your medications beforehand. In some states, you are not able to get your narcotics until day of surgery. But if you have antibiotics or nausea medicine or anything like that, get that picked up beforehand. You may get a prescription on day of surgery that your partner or your husband or your healthcare provider can go and get filled while you're in surgery. That's a good time to pick up ginger ale, Ritz crackers, stuff like that, that might help with any problems that you might have with nausea. Also in that plan, prepare your meal ahead of time. I recommend always, for the 50 years I've been doing this, to not eat something hot, heavy, or spicy, because those things, not only is your stomach slowed down from anesthesia, but those things don't taste good coming back up. And so I recommend the old staple of chicken noodle soup, miso soup, tom yum soup, anything that's easygoing for that first meal. After that, do whatever you want. But with that first meal, your body will get the message that you are all right. Trust me on this. This one meal will make a difference for you. After that, take a nap and then get up and see how you feel. Just keep it simple and light that first 24 hours. You'll be grateful afterwards. 3, make sure you have your home health pal and your ride home available, and that you guys have a little bit of a plan. Most institutions recommend that you have somebody available 6 to 8 hours after your surgery, and sometimes 24 hours. I recommend 24. Make it a pajama party. Why is this important? Because it takes a while for your body to metabolize the medications that you've taken. Not just what you're taking by mouth, but all that medication you've had in the operating room, the anesthetics. It takes a while for that to metabolize out. I'll talk a little bit more about that later. Another super important thing that you need to know is that there is a reason that we tell you that you have to have a ride home. It isn't just because you might have an amnesiac on board and you already have narcotics on board. If you're stopped in traffic or if you have an accident on your way home, it's possible that they'll do a blood test and they'll find that you have narcotic strength medications on board. And it doesn't matter that you had it during surgery. You are driving under the influence. So don't do it. Don't do it. Those are the 3 things that I think are really important to know. I thought I would help you understand what it means by nothing by mouth, why we ask you to do that. And here's the reason. When you go to sleep with anesthesia, it relaxes you, as we all know, very much. And one of the things it relaxes is your esophagus. What that means is if you have food down in your stomach and there's movement or there's a wave of peristalsis in your stomach, that will come up and it will have only one place to go, which is into your lungs. Not good. That causes all sorts of problems later on. Be mindful that we're not asking you to starve for no good reason. We're asking you because we want to prevent you from having what's called aspiration or aspiration pneumonia. We want you to be healthy when you leave our unit. So please, if you eat, tell us. We'll reschedule you. Otherwise, don't eat after midnight, the night before your surgery. Here's something you can do. You can set your clock for 8 to 12 hours before the time of your surgery and get up and have something light to eat and then go back to bed. That's acceptable, but it has to be 12 hours before your surgery. Another just little note on alcohol. Remember that alcohol is dehydrating. So even as you're hydrating the night before, if you're drinking alcohol, you are dehydrating your body. So if possible, take it light before your surgery and follow with a glass of water. Let's talk about recovery. When you wake up in the recovery room, you may wake up on the hall, going down the hall. You may remember it. You might not. Just depends on the medication that they use. But once you wake up in the recovery room, all your monitors will be on. There will be a nurse at your bedside smiling, asking you how you feel. We'll hook you up to the monitors in the room. We'll get ice on your incisions if you have one. It's just a period of time, usually 20 to 50 minutes, while you are waking up and we're finding out how you're doing. The nurse will listen to your heart and lungs, listen to your belly. Once we do that, we just let you rest and breathe out as much anesthesia as you can get out. Three things that matter in recovery to the nurse is discomfort and pain, nausea, and hydration. You'll still have your IV in, and once you're waking up and you're more alert, the nurse will give you something to drink or ice chips. Just a little bit about surgical discomfort. It's not a surprise that you're going to have surgical discomfort when you consider that your body itself has millions of nerve endings, and they're all pain nerve endings. Like when you get a sticker in your finger, it hurts, even though it's a little tiny hole. So it's no wonder that we have discomfort. If you understand the body, you know it doesn't like to get penetrated. So you're going to have some discomfort. What our goal is to get you comfortable enough that you can go home, as I said, and get into your bed and get some rest. We measure it by a pain scale. We'll ask you 0 to 10, how is your pain? Sometimes people have a lot of pain. Some people have no pain. It just really depends on you, and we will do our best to get you as comfortable as possible so we can get you home. I think what I'm trying to say is it's reasonable to assume that you're going to have some discomfort and that we will make it as manageable as possible so that you can heal. Nausea is not as common as it used to be, and we've really created a lot of great medications to help with that. So generally we start out, anesthesia will start out by giving you something ahead of time. If you have a propensity to it, then we'll give you more. But we know the importance of not having people vomiting. So we are making sure to minimize your nausea from your surgery. Sometimes the nausea is a reaction to the narcotics and the medication you have on board. So when you get home, you want to have something to eat before you take your pain pills. We talked about dehydration before. Fluids are important. Your IV is not only your way of getting your medications, but it's also to keep you hydrated throughout surgery. Once you're out, we will start you on fluids by mouth. One of the most understated things in post-op period, even though there's plenty of research on it, is breath work. I mean, we all hear about it. We hear about it in yoga and we hear about it in running. And breathing deeply is crucial in recovery. The reason being that what gets the blood flowing is the oxygen. Taking deep breaths helps to circulate oxygen through your body, which helps to get your pain medicine to where it needs to go, but also to exhale your gases that you have while you're asleep. So it's super important to be taking deep breaths. When you get home, one of the things I tell people is every hour you're awake, take 4 deep breaths and a short cough. So like deep breath, 4, and then hold your incision, little cough. Super good for you. Helps to move the liquids and fluids in your lungs up into your trachea so you can cough any excess gas out. That's how you help metabolize your anesthesia. Another interesting thing is that when you don't breathe, it's something I call resistive breathing, which means you don't want to breathe because you're afraid it'll hurt the incision. I'm here to tell you when you hold up, you're not getting full expansion of your lungs, and this is important. So work towards being able to breathe completely down through your lungs and out. When you come into recovery room, a lot of people are shallow breathing because you've had something else helping you to breathe in the operating room. So it's important to do those deep breaths, especially once you get home. We have talked about rest's crucial to getting rest. And as I said, get home, get in your comfy place. I think it's hysterical that people tell me, oh, I've got 4 videos I'm going to watch when I get home. No, No videos, rest, eat, rest. And when you wake up from your first nap, you can start thinking about your videos. The last thing I think is important is moving your body. Now, I don't mean go out for a run. What I mean is when you're in bed, stretching your hands overhead, stretching out, moving your legs a little bit, maybe pull a knee to your chest, pull the other knee to your chest. These are just simple movements that allow and tell your body that things are all right and you're going to be okay. When you're in the operating room, you're in a specific position for a period of time, maybe 2 hours, maybe more. Because of that, you may be a little sore just from not moving. So don't be surprised if you're achy the next day or two. This is normal. The last really important thing I want to share with you is mindset. If you come in without understanding, in fear, those things affect your surgery. So the more you know about your surgery, the more you're going to feel good about yourself and the safer you're going to be when you come in. It really matters what you're thinking about and what you're focusing on when you get there. As Michael Dooley said in The Secret, thoughts become things, so think good thoughts. And this is super important when it comes to surgery. We'll help you with that. Our goal is to make your procedure and your event in the hospital or outpatient unit to be the best and most comfortable experience. If you like this video, I have a booklet handout available to you on Stan, and the link for that is below. My goal ultimately is to be sure that patients have the best surgical experience possible. I know how much it matters to patients, both before and after, because we speak to everybody before and we speak to people afterwards. So we know what really works to help people have a good experience. I want you to know the booklet has much more information in it. It lets you know why we do the things we do when you come in, and to let you know that our ultimate goal is to have you comfortable and home and safe.